In the previous section, we have seen in detail about the classification of the hormones and the receptors and the ligands and the activation principles and also the downstream signaling pathways and their applications on clinical medicine and therapeutic targets. This is even more an important video because here you're going to understand the most important concept of feedback and feed-forward systems and their applications on how to diagnose an endocrine disorder based on those. So let us move on. So let us see what you mean by a feedback and what you mean by a feed-forward system. This is going to be the first topic on this video. So what do you mean by a feedback and what do you mean by a feed-forward system? To understand this, let us take two systems that are working with their own internal regulatory mechanism. So these are the variables and their internal regulatory mechanisms in these two systems. The arrows I have mentioned here are variables and the regulatory mechanisms that are happening within the system. Now, let us see there is a disturbance that is happening that is causing a change in this particular variable, which means this is a changing variable here, which means the delta means the change is happening in that variable, and the change that is happening in that particular variable is going to create a sequence of changes within the system. These are the regulatory mechanisms that are happening within the system that is finally going to affect this variable again. Finally, that is going to affect the variable again. So this is what we refer to as a feedback, where that variable will come back to normal or that changing variable will keep on changing more and more. That is different. So that is the basis of either it's a positive feedback or a negative feedback. But this disturbance causing a change in a particular variable in the system that is creating a sequence of changes within that system, those regulatory mechanisms, that is either changing the variable more and more or neutralizing the variable, which means that is affecting the variable once again. So this is what we refer to as a feedback. So what do you mean by a feed-forward system? So here you have a disturbance, but note clearly here, even before the disturbance can affect a particular variable in that system, that is affecting the regulatory mechanisms directly, which means that system's regulatory events are directly affected. So which means even before the change in the variable is happening, these regulatory mechanisms will be activated by the disturbance itself directly. That will create a change in the system already, and that will affect the variable even before the disturbance is going to affect the variable. Clear? So the disturbance is affecting the regulatory mechanism that will affect the variable even before the disturbance can directly affect the variable. So this is what we refer to as a feed-forward system, which means the feed-forward systems happens in anticipation, which means it's an anticipated response, whereas feedback is a non-anticipated response. The change in the variable should happen to create a change in the system. But here the change in the system happens even before the variable changes. The disturbance itself induces the changes in the system. So this is what we refer to as a feed-forward system. You have a negative feedback, positive feedback. Similarly, you have a negative feed-forward and a positive feedback. How about these terminologies, negative and a positive feedback? So let us see two examples where I told you there is a disturbance is happening like externally, and that is causing a change in the variable that is creating a activation of regulatory mechanisms within that particular system. If that regulatory mechanisms that are working so that they are trying to neutralize the change in the variable, which means they are trying to neutralize the change in the variable, which means they are bringing back the system to normal. This is what we refer to as a negative feedback. This is the idea of a negative feedback. Remember, the arrows doesn't matter. The idea of negative feedback is to neutralize any change in the variable that is happening. So this is a negative feedback. Similarly, if the regulatory system is acting in such a way, which means the same regulatory system is acting in such a way that is trying to cause more and more changes in the system. if it's trying to cause more and more changes in the variable, which means the change is going to increase, this is supposed to be a positive feedback. This is what we call it as a positive feedback, which means the disturbance is causing more and more change in the system and more change in the variable. Here the disturbance that is causing a change in the variable, causing a regulatory mechanism activation that is actually trying to neutralize the change in the variable. So this is what we call as a negative feedback. So they are completely different. If the variable is coming back to normal, that's likely to be a negative feedback system. The variable keeps on changing over time and it changes more and more over time, that is called as a positive feedback system. So how can you understand this negative and positive feedback? With a very simple example. Let us see. You have a very common example, a food that is going to create a disturbance or a change in the variable, that is the glucose. Glucose is going to increase, which means the food is the disturbance here. That is creating a change in the variable in the form of increased glucose. This is the variable here. Let me put in red color. This is creating a regulatory mechanism that is increase in glucose. Clear? That is increase in insulin. Which means this increase in insulin is a regulatory mechanism that is going to actually trying to neutralize this excessive glucose, which means it's going to normalize the glucose. Where you can see this regulatory mechanism is happening in such a way that is trying to neutralize the change that is happening. That is trying to neutralize the change in the variable. So this is a typical example of a negative feedback loop. So you might argue that increase in glucose causing increase in insulin, same direction means it's a positive feedback. No, it's not about the direction. It's about the overall change in the system that is happening. This excessive glucose is acting in such a way that's trying to lower the glucose levels itself. So the variable itself is trying to control itself. So this is a negative feedback loop, which means no external brake is needed. Even if the disturbance is happening continuously, this system can balance on itself because the mechanism is like that. So they are trying to control themselves. Here you don't need any external brake to control the system, to control the change. The system itself controls the changes that are happening within that particular system. So this is what we call as a negative feedback, and you don't need any external brake. Even in the presence of the disturbance, your system might control the glucose and the insulin values by itself. Similarly, once the glucose normalizes, what is the need for insulin to increase? Insulin also will become normal after some time, which means the system controls itself. It's a regulatory mechanism. This is what we call as a negative feedback system. So what is an example of a positive feedback? A lot of examples are there, but I will give you an example of a clotting factor mechanism where you have an endothelial injury. This endothelial injury here is going to act as a disturbance that is going to cause thrombin formation. This thrombin is going to activate the clotting cascade more and more. This clotting cascade amplification will cause more and more amounts of thrombin formed. So here what happens is, here the disturbance is causing a change in the variable. So here is the variable and it's activating some regulatory mechanism within the system, and that regulatory mechanism, rather than neutralizing, here also the regulatory mechanism is trying to bring a change in the variable. That is fine. See, anything that brings a change in the variable, so that is a feedback system. Fine. Here the change in the variable is actually not neutralized. Here the change in the variable is actually increased. Increased change in the variable. So with each passing cycle, the change in the variable will be more and more, which means the thrombin is going to keep on increasing rather than neutralizing. So this is a best example of a positive feedback loop. Clear? So similarly, I can tell an example of a feed forward system also. You have a positive feed forward also and a negative feed forward also. I told you here the disturbance will directly induce a change in the regulatory system rather than even before they are going to bring a change in the variable. Like for example, here let us take a disturbance once again as food. This food, even before it brings a change in the glucose. So the glucose is the one that's going to change, but even before that changes, the change happens, this food can directly increase the insulin release. How is this possible? This mechanism is what we refer to as incretin effect. Just by stretching the duodenum, from the duodenum you get some substances like GLP-1 and GIP, glucagon-like peptide 1 and gastric inhibitory peptide. So these are what we refer to as the incretins. And these incretin molecules will go and increase the insulin secretion from the pancreas even before the glucose levels increases, which means this is a anticipatory response, because this food, once it gets absorbed, definitely the glucose levels will increase, but the insulin levels are already high, trying to neutralize this glucose levels that are going to rise. So this is an anticipatory response. So that's why it is actually here the system is trying to control the change in the variable. So that is why this is a negative feed forward system. So this is an example of a negative feed forward. Similarly, you have a positive feed forward system also. For example, cephalic phase of acid secretion. Here, just the sight of food or the smell of food itself will increase the acid secretion. Not only essentially the food in the stomach should increase the HCl secretion. So this is what we refer to as a positive feed forward system. Like that, you have many examples for that. In cerebellum, the granule cells and Purkinje cells mechanism through the inhibitory interneurons. So this is a negative feed forward system. So you have a lot of examples of a feed forward system also going on in the body. But the most important things to understand is the feedback, because this is the most common type of mechanism happening in our body. That's a feedback system. And for a system to be stable, it has to be having a negative feedback. And that's how endocrine system works. Most of the mechanisms in endocrine system will be negative feedback loops only, because the system will try to maintain itself without a need for any external break. For example, in this condition, in a positive feedback, I didn't tell you this, you need a external break, which means something has to give up, then only this will stop. For example, here the disturbance should stop, or you have to put some external breaks in the system, then only this will stop. Otherwise, this will keep on continuing like a vicious cycle again and again. So this is the best important point about a positive feedback loop. You need an external break to stop the cycle. Here you don't need any external break. The system itself controls and tries to stop a formation of a vicious cycle here. So this is what we refer to as a negative feedback. So I think now you can get a good idea about what you mean by a feedback and a feed forward system. With this understanding, let us move on to how the endocrine organs are regulated, and they are going to get regulated by negative feedback system only. So majority of the things that are happening in endocrine system are essentially negative feedback loops only, which means what are the different ways how they can regulate this negative feedback loops, and what are the different mechanisms. That's what you're going to see. So there are two types of organs you have to classify among the endocrine system. One is organs that are located within the HPA axis, that is hypothalamic pituitary axis, and second are the organs that are located outside the hypothalamic pituitary axis, which means they are not located within the hypothalamic pituitary axis. So what are the organs that are located within the hypothalamic pituitary axis? Three classic organ systems: adrenals, gonads, and thyroid. So these are three classical examples. Even though growth hormone, prolactin, you might think they are located within the hypothalamic pituitary axis, but I believe these are three most important organs, the basophilic hormones. Clear? So acidophil hormones are different, growth hormone and prolactin. The basophil hormones are your that are actually maintaining your cortisol, thyroxine, and gonadal hormones, testosterone, estrogen. So these are the most important: adrenal, gonads, and thyroid. For classic examples, knowing classic examples of a hypothalamic pituitary axis. But let us see what is the concept first, understanding. So what is the concept behind this HPA axis regulation? In the HPA axis regulation, you have a different organ which is going to act as a sensor, and second it's going to act as a regulator, and it's also going to act as a effector organ. So three different organs are there. So first one is the sensor, second one is the regulator, and third one is the effector. Clear? Here the sensor will give stimulus to the regulator will give stimulus to the effector, and the effector is going to produce some target hormone, And this target hormone is the one that are going to have peripheral effects. And usually hormones that are located within the HPA axis will have more of biologic effects rather than metabolic and biochemical effects. Biologic rather than metabolic effects. Metabolic means here I mean biochemical effects. They are going to have more of a biological effects. Fine. So who's going to give feedback? Because I told you endocrine systems work predominantly by negative feedback loop. Who's going to give the feedback here? The feedback is going to be given by the target hormone itself. This target hormone gives feedback to the regulator as well as the sensor, but the most important way of giving the feedback is to the sensor. Sensor is the one which receives the maximum feedback. Yes, it gives to an extent to the regulator as well. So this is the concept here. Fine. So let us see an example now. So this sensor is going to be hypothalamus. You would have definitely studied this, which is going to stimulate or inhibit. It depends. Some kind of stimuli it is going to give to the regulator. Here the regulator is going to be the pituitary, without a doubt. So from the pituitary, you go to the effector organs. I told you it could be one among the three. Could be adrenal gland, could be gonads, or it could be even a thyroid gland. So they are going to secrete some target hormones. Target hormones can be either testosterone or estrogen, or it could be thyroxine, or even it could be a cortisol. So any of this target hormone is going to give feedback to the hypothalamus as well as to the pituitary, but the major feedback will be to the hypothalamus, right? So, and these target hormones are the ones that are going to cause peripheral effects, which are going to be more biological rather than this metabolic and biochemical effects. Still, having a doubt, let us see a simple example in the form of thyroid loop. So you have hypothalamus that is going to secrete a hormone called TRH, that's called TSH releasing hormone or thyrotropin releasing hormone. So where in the pituitary you have a group of cells called as thyrotrophs that are going to respond to this TRH and they are going to release TSH in return. This TSH is going to stimulate the thyroid because the TSH has this TSH receptors which can sense this TSH, and they can stimulate the TSH receptors and the thyroid to produce thyroid hormone. And obviously they are going to produce more of T4 than T3, obviously the homeostasis of which we will discuss in some time. So, and these hormones are going to create peripheral effects, and this T4 is the one that's going to give feedback to the hypothalamus as well as to the pituitary. So very simple, elegant anatomy. So which means you have a separate organ for sensor, effector and regulator. You have three different organs for three different functions. So this is the concept of how a HPA axis hormones are going to work. But how your glands outside the HPA axis are going to work. Let us write here. These are the organ systems and endocrine glands that work outside the HPA axis, that is hypothalamic pituitary axis. In this, the concept is very simple. A same gland, the single gland is going to act as a sensor, regulator as well as the effector. And this is going to secrete a target hormone. And obviously this hormone is going to have some peripheral effects or target effects, where in this particular loop outside the HPA axis, the target effects will be more biochemical and metabolic than biological effects. I'll tell you with examples, more biochemical effects and metabolic effects than biological effects. Here the idea is this effect is going to give the feedback to the system, negative feedback to the system. There I told you it's the hormone that is going to give feedback to the system, right? It's the hormone that is going to give the feedback system, not the effects. But here it is the effects that are going to give the feedback to the system. Clear? So this is what we called as glands that are working outside the HPA axis, not a typical HPA axis related hormone. So what is the best example? I can tell numerous examples. Let us take A parathyroid gland. Parathyroid gland, because parathyroid gland can sense calcium in the form of a receptor called calcium sensing receptor. Let us assume, so they are secreting parathyroid hormone. So this parathyroid hormone is going to increase the serum calcium, even though there is a decline in the serum phosphate, but right now stick on to the basic principle that they're going to increase the serum calcium. Once the serum calcium is increased, the serum calcium itself will give feedback to the calcium sensing receptor in the parathyroid, which is going to inhibit this, and the PTH levels will drop, which means the serum calcium will normalize. Drop in the sense I'm meaning about normalizing the serum calcium. So serum PTH. So PTH will normalize and the serum calcium also will normalize. Clear? So this is here the effect induced feedback. So this is how glands outside the HP axis works. Even glucose and insulin works by the same principle, because here the pancreas releases insulin, insulin causes low glucose can go and inhibit the pancreatic release of insulin. Similarly, high glucose can stimulate the pancreatic release of more and more insulin. So this is how it works. So these are the things. It's an effect induced change in the hormone secretion. So this is what we refer to as organs, mechanism of action of organs that work outside the HP axis. So these two principles are really important to understand. Clear? So how we are going to diagnose endocrine disorders based on this? There are many ways to diagnose an endocrine disorder. Whenever you want to diagnose an endocrine disorder, diagnosis of endocrine disorder is based off three things. One is by using stimulation and provocation tests. Stimulation provocation tests or suppression tests. Second is by direct measurement of hormones. Direct measurement of hormone levels. And the third one, you have some special investigations like radiological investigations, serological investigations, especially we can diagnose based on the antibodies, and other investigations like HbA1c and all this stuff. So these are some other investigations, special investigations that you're going to do. So how we are going to make a diagnosis? Remember, measuring this direct hormone levels will not be accurate, most of the times, but with special reference to, especially it's not good in patients who are having problems in HP axis, hypothalamic pituitary axis problems. It's very difficult to accurately determine the problems that is happening within the HP axis by just directly measuring the hormone levels, because the hormones that are involved in HP axis is something like it can change second by second, like minute by minute, because of the physiological cues. So it's not really good to measure this HP axis problems with a stat or a spot hormone level, not possible. But still it is useful for certain hormones like prolactin. It is useful for certain hormones like insulin. Clear? It is useful for certain hormone measurement like PTH, which means majority of these hormones, prolactin, again you can argue whether it's HP axis hormone or not. Yes, technically it's an HP axis hormone, but I told you growth hormone and prolactin may not. So it's like that. But definitely your cortisol, testosterone, estrogen, then thyroid, all these things will typically come under the HP axis. So there is no doubt about that. So, but prolactin, yes, maybe no. Growth hormone, yes, no. So they can come under HP axis, but technically speaking, but theoretically, yes, but practically, if you ask me personally, I will tell maybe not. But anyway, prolactin can be directly measured, insulin can be directly measured, and PTH also can be directly measured. These are some examples where the hormone levels are directly measured. But majority of the times, if you suspect a HPA problem, that is hypothalamic pituitary axis problem or hypothalamic pituitary axis issue, you have to confirm the problem by doing either a stimulation or provocative test or a suppression test, but not all the time, but still helpful. So what are the basis of this stimulation and provocation test or suppression testing? Okay, let us see a gland and it is secreting a hormone and you're suspecting that this gland is hyperfunctioning. For example, this gland is secreting more and more hormone because the clinical features are suggestive of a hormone excess. So you wanted to know whether this hormone is excessively getting secreted or not, and is there really any problem in the gland that is secreting the hormone in excess. So how will you find out? So what I'm trying to do is I'm going to try to suppress the gland, inhibit the gland. If I inhibit this gland, definitely a normal response. If you want to expect a normal response, means the hormone output should drop. Hormone output should decrease. That is what is the expected response here, because I'm trying to inhibit the gland. But on the contrary, if the hormone output is still very high, definitely I can conclude that this gland is abnormal for sure. There's no doubt about that, because even after trying to suppress the gland, still if the hormone output is increased, means it's clearly abnormal. Or if the hormone output is normal, even after suppressing the gland, still it is abnormal. Even though it might be earlier stages of abnormality, but still it is abnormal, because it is not possible unless and until you have excessive hyperfunctioning of that particular gland. Inhibiting a gland causing normal hormone secretion is not possible unless there is associated hyperfunctioning of the gland. So if after giving an inhibitory signal or a suppression signal to the gland, if the hormone levels are high, or even if the hormone levels are normal, I'm going to suspect this patient is having excessive hormone secretion from that particular gland. So these type of tests are what we refer to as suppression tests. And characteristically, these suppression tests are used whenever you are suspecting a hormone excess, which means these suppression tests are used to confirm hyperfunctioning of a particular gland. Clear? So that's the idea. So the best example you can understand is dexamethasone suppression test, which are going to use for Cushing's. Cushing's is a hormone excess state, isn't it? So for excess states, you can use suppression test like dexamethasone suppression test. Similarly, you are having a gland, but you are suspecting that this gland is hypofunctioning, which means you are having clinical features that are suggestive of hormone deficiency from that particular gland. Clear? Now what you are going to do is you are trying to stimulate that particular gland. You are trying to stimulate that particular gland. If you stimulate this gland, what will be the normal response? Normal response must be the fact that hormone levels should increase. They should synthesize excessive hormones. That's the idea. But even after stimulating the gland, if your hormone output is very low, consistently low, or even if it is normal, I'm going to consider this as an abnormal response. Remember, by stimulating the gland, I should get a hormone excess only. But even after stimulating, if consistently my hormone levels are low, or even if it is normal, I'm going to consider this as a hypofunctioning only. This kind of ways of stimulating the gland to test for hypofunctioning of a particular endocrine gland is what we refer to as a stimulation test or provocation test. So stimulation or provocation test is useful for testing hypofunctioning of an endocrine gland. The best example for this is ACTH stimulation test, which is done in deficiency states like Addison disease or adrenal insufficiency. In patients with adrenal insufficiency, you can use this ACTH stimulation test. Clear? To confirm a presence of an adrenal insufficiency, which is a hypofunctioning disorder. So this is the idea. This is what you have to know. So this is how the knowledge will help you. The feedback system knowledge will help you. So these are what we refer to as a stimulation test and provocation test or a suppression test. I told you certain hormones also can be directly measured at special circumstances. And what are the special investigations? You have radiological investigations. For example, you have MRI, you have CT imaging, you have CT scans. For example, a thyroid scintigraphy is very, very useful for diagnosing or making a differential diagnosis of a primary hyperthyroidism. Similarly, many other scintigraphy are there. Sestam scans are there, which you can use for parathyroid hyperplasia and adenomas understanding. And similarly, a lot of PET scans are there, which you can use for pheochromocytoma. Similarly, a lot of scintigraphy and nuclear scans are available. And serological, many antibodies are there. Typically, the most important antibodies that you will encounter in the entire endocrine system is TRAPs. These are TSH receptor antibodies or thyroid receptor antibodies, or simply called as TSH receptor antibodies. Very, very specific for Graves' disease. So you can find out this. Other investigations you can do HbA1c. You can have a lot of other variety of C peptide levels. A lot of other variety of other investigations are also there which you can try to do. So many investigations are there. So this is how you diagnose a endocrine disorder. Especially this stimulation, suppression and provocation testing concept should be very, very clear in your mind how to diagnose this. Fine, but we didn't tell you certain examples of positive feedback loops in our body. So what are the examples of positive feedback loops in the body? The first example is pre-ovulatory LHH. Yeah, pre-ovulatory LHH is one of the very important examples of a positive feedback loop. So why this pre-ovulatory LHH is a positive feedback loop? I told you positive feedback, you need an external brake to control the system. Here, estradiol, normally it's a negative feedback hormone, which means it's going to inhibit the LH and FSH. But here, during ovulation only, estradiol assumes a positive feedback loop rule, which means it assumes a positive role, which means it's going to increase the luteinizing hormone levels. So increased luteinizing hormone will further increase the estradiol. Increased estradiol will further increase LH. Increased LH will further increase estradiol. Increased estradiol will further increase LH, and it keep on going like this, like a vicious cycle, unless and until there is a break that blocks both in the form of ovulation. So which means ovulation is a break here. So you need an external break to happen, then only this cycle will stop, otherwise it will not stop. Number 2, childbirth. That is parturition, where you are going to have a classic Ferguson reflex. So this is what we refer to as a Ferguson reflex in parturition. So what happens initially, you get this Braxton Hicks contractions. These are small, low intensity contractions that is going to increase the oxytocin release. So this increased oxytocin will increase the contractions further. This increased contractions will further increase the oxytocin. This increased oxytocin will further increase the contractions. So this will keep on, which means the changes will happen more and more over time. So that's a positive feedback, unless and until it's interrupted by a external break called childbirth. The childbirth should happen, and this should cause a break in the system. Otherwise, this will keep on going. This is a Ferguson reflex. Similarly, you have a lot of other examples like lactation also. Milk ejection reflex, where I can call it as milk ejection reflex. And again, it's oxytocin mediated only. Like for example, the child sucks the nipple, and that will create a rise in oxytocin that's going to cause more and more milk ejection. So similarly, this cycle will keep on continuing unless until external break will happen. That external break here is the removal of the child from the nipple stimulation. So that is the external break. Unless until that happens, this will keep on rising more and more and more. So this is called as a milk ejection lactation reflex. That's also an example of a positive feedback loop. Similarly, you have a lot of other examples of a positive feedback loop, like clotting cascade, which we have discussed already. Clotting coagulation cascade mechanisms, platelet aggregation mechanisms, irreversible shock, where there will be uncontrolled activation of sympathetic system. Then inflammation and inflammatory mechanisms, countercurrent multiplier in the kidney. For example, vasa recta, countercurrent multiplier in the kidney, and micturition, apoptosis, and in the sarcoplasmic reticulum, you have a mechanism called calcium dependent calcium release or calcium mediated calcium release. So this is also an example of a positive feedback loop within the sarcoplasmic reticulum. Like this, you can see so many physiological reasons itself we have a positive feedback, which means your body is not entirely made of negative feedback. You need some positive feedback loop systems also. So these are some of the examples of positive feedback loops that are operating within your body. So I think this is a very short video. With this, we can complete this video. In the next section, we'll be moving on to the pituitary gland.